Hi, everyone. This is Dr. Ann Jones, Medical Director from Cornell Health, and I'm here to answer some common health questions that are coming up about coronavirus and the COVID response here at Cornell Health, the importance of social distancing, and the continued importance of recognizing that we as a community have a responsibility to come together to help flatten the curve for the community and to help keep everyone here in Tompkins County healthy and safe. There are three mechanisms that are public health mechanisms for helping prevent the spread of coronavirus during this pandemic. And they kind of have different levels. One of them is called isolation. And isolation is kind of the strictest sense of social distancing. The second is quarantine, and the third is then social distancing. So in isolation, that's when someone is sick and has to protect themselves from everyone else around them. And when a person gets sick during this pandemic phase, those symptoms of cough, fever, shortness of breath, and then other symptoms like sore throat, or recently we've also been seeing the symptom of having a weird taste in one's mouth or having loss of taste. These symptoms are symptoms that if someone gets those symptoms, it's important to call your healthcare provider and then look for options for testing. And there are many options for testing here in the community. The testing clinic at Cornell is one option available to those individuals who are eligible for care at Cornell Health. And then similarly, there's a testing clinic up at the mall through CMC and the health entities in town. So if you're sick and you get tested, it's important to self-isolate. And there's a very specific definition about what isolation means in that context. What that means is that you're separating yourself so that you can help yourself get better and that you can protect everyone else around you. So when you're setting up your environment to meet criteria for isolation, what that means is you want to have a private bedroom, a private sleeping space, a private bathroom, and a private kitchen. Place where you can make your own food, take care of yourself, so that you're only doing that by yourself and not exposing others to that. Now, some people might be in a living situation where they might have access to a shared kitchen and then maybe a smaller isolated kitchen area. It's important to make sure that if you have symptoms and you're awaiting testing and you're in a situation where you have to be isolated, that you actually take supplies that you need for a private food preparation or private bathroom into a space that only you are going to use, and then stay in that space until the time is over. The next level of protection, it comes in quarantine. Now, quarantine is different in that we use quarantine to separate individuals who are not sick, but have been exposed to illness. And so in quarantine, there are two different types of quarantine. There's what's called mandatory quarantine and then precautionary quarantine. In mandatory quarantine, that is when there's been a known exposure to COVID-19 and there is a required period of quarantine for 14 days after the known exposure. Anyone who's had an exposure to someone who's had a positive result should be contacted by the health departments in the community. And in our community, the Tompkins County Health Department would be reaching out to individuals who met the criteria for exposure and who would be required to be in mandatory quarantine. When you're in mandatory quarantine, you have very similar setups in that you need to be making sure that you have an area that you have to yourself and that you don't expose others if you do get sick while you're in that quarantine. The precautionary quarantine, in a situation where there's no known exposure to a positive case, but there is a potential risk for exposure based on, say, someone's travel status. So say coming back from an area where there is an outbreak or a known community spread of COVID to precautionary quarantine. So for mandatory and precautionary quarantine, it's the same designations: private sleeping area, private kitchen, private bathroom. The third type of protection is called social distancing. And social distancing is what we've been hearing a lot about. It's that maintaining of a 6-foot distance between you and anybody else. And what's important to remember about social distancing is that it's all about protecting others around you. It's about protecting the community. There's important do's and don'ts to social distancing. Even if you're standing 6 feet away, not to be passing items back and forth, because we know that COVID-19 is passed through respiratory droplets. So if those respiratory droplets are on items that get passed back and forth between individuals, that may be a source of potential spread. Things to watch out for are, ensuring that there's not a congregation of individuals who are all coming together within close proximity and then passing things back and forth between them. It's important to remember the importance of that. Doesn't mean social or emotional distancing from others. And I think that one of the things that we've been seeing so much of is the importance of checking in with people, even if we can't be physically close to one another, being able to check in with each other, maybe through virtual platforms or through phone calls or through other fun, cool apps or other social media opportunities to connect together. And that's one of the things that many have found to be very helpful, especially in this environment. Those are the tips about isolation, quarantine, and social distancing. And I wish you much health, much safety, and all the best as we continue to come together to get through this unprecedented time. Thank you.